Dr. Patrice Little with NP Student Mag, where we're keeping you updated with every aspect of your life in and out of school. Today, we are talking care for our veterans with Anna Sanchez, founder of Hope Center for Veterans in Lawrenceville, Georgia. Welcome, Anna. How are you?
Hey, I'm fine. I'm excited to be here. Thank you, Dr. Patrice, for letting me come and talk to you and share to you my passion in this field. My Hope Center for Veterans. Thank you.
Oh, well, we're excited to have you. So let's move on to the first question, which is tell us about you as a nurse.
So I am a psychiatric nurse practitioner. I'm dual certified as a psych NP and also a family nurse practitioner. As we know, in the field of psychiatry, a lot of our folks have the medical issues. So I had to do that and be able to care for my patients. I currently work at a local hospital and in the emergency room as a psych NP. I have been working in psychiatry for the last 10 years now in the field of psychiatry, but have worked in healthcare for the last 34 years. But I'm also just regularly 21 years old. Okay, we don't talk about age.
Exactly.
But yes, so I've started as a medical secretary before. We don't even use that term now. I became a medical assistant. I became what do you call this? The muck in the hospital. So many different fields and different departments that I've worked in, and I think that for me, that experience that I have, I'm able to relate to my peers, no matter what. Environmental services, security, all of those, because I've been in many fields in healthcare. So that's a good thing, and I appreciate that.
And not only are you relatable, because that's one of the things that I love most about you is your appreciation for various backgrounds and roles. You also had a unique opportunity to serve as in the military. Can you tell us a little bit about what like a veteran is and what branch you serve in?
Yes, so I am a traditional reservist in the United States Air Force. Currently, I'm on active duty orders. So I go to the base, I work there in the nursing section as a clinical nurse. You have the active duty side, you have the traditional reservist. And for me, if I'm not on orders as an active duty, then you go monthly to the base where you're attached, and then you do drills once a month, and then you have 15 days of training. In between, you might be put on orders. It is different training, very specialized training. Only 1% of the population in the United States are in the military. So that's very small compared to the whole range. How many women? Smaller, right? Mm-hmm. So as women, diversity is important so that we can share that in the military, share our skills, share our background, and that is important. Being on active duty right now, I am currently helping the director of psychological health. I'm working the SAPR office as well and helping them with their courses for the volunteer victim advocacy. I'm also helping the VPI, which is the violence prevention integrator. So that's at the wing level. I'm at the squadron level, but I'm helping them out. So the skills that I've had is important. I was deployed last year in Korea as a coordinator for the sexual assault prevention program. That was big. I've learned a lot. I've collaborated with the active duty folks. I've collaborated with our Air Force, Republic of Korea, and that has broadened my reach, right? You're educating as a nurse practitioner, as a nurse, you're educating your patient, you're educating the population that you serve. So that continues even in the military, and that's a big thing.
I like that you mentioned that, because when we think nurse, oftentimes we think of hospital. And it's so important as advanced practice nurses, and then even more specialized as a nurse who's a veteran and who served, to really put that information out there of the various roles and why it's so important to continue that education in the different areas and specialties. Can you walk us through the day in the life of your organization? Because you were a founding member of an organization that serves people who are just like you. What's
Mhm.
it like typically?
So when I work at the hospital, the local hospitals, I thought, how come our veterans are coming in more and more in our civilian hospital? Why aren't they going to the VA hospital? What's going on there? So there's a backlog. There's a lot of red tape as well. And there's also the trust issue that they have as patient veteran to the provider. They
Okay.
prefer to see see the provider outside, and that makes them feel comfortable because the VA is very similar to the military ranking and how that is, and people might not want to go there. So instead they come to the other civilian hospitals. So I thought, okay, I better do something because there is a backlog. I am going to use my skills like you're doing right now, use that skill in order to help and continue to help the veterans or whatever population you're serving. So that's what I did. So I founded this 501c3. It's a nonprofit organization. 80% of our board of directors are also in the military, retired and still working and helping me out. So we outreach, we go to the community, we collaborate with other nonprofit organizations as veterans and also helping other people. It's like, okay, what is it this veteran need? Come here, I'll show you where to go. We have, yes, yes.
So
So
is that like a referral service, in a sense you connect them with the resources that are out there for continuity of care?
because they might not get it at the local hospital or they might not know where to get it. So text so-and-so and oh, okay, there it is. That's where you can go,
Are
right?
there any health services provided at all? Or is
Um,
it more so like a referral based organization?
we were doing nursing, vital signs in the initially, and then we were doing face-to-face substance abuse groups
Okay.
also, but COVID kind of changed our
Oh, yeah, it shifted.
Mhm. It changed. So
Mhm.
now a lot of outreach would be on the phone calls, texting, also via Zoom, like what we're doing, and talking to our veterans and making sure they reach out. So if I'm working at the local hospital and there's no referral that's available for this, I reach out to other people and then make that contacts. Those are important, right? So that that veteran can get the help that they need.
Now, when it comes to the different needs that they have, one per se that is highly noticeable by us civilians is mental health services, particularly post-traumatic stress disorder, also called PTSD.
Yes.
What other types of needs do veterans have?
Ooh, that's a lot. So as a provider, I want to reach out to everyone that's watching this video that before you even talk to a veteran, make sure you know which branch they go to. Not all military service members are soldiers. I'm an airman. I'm in the Air Force. The Marines, different, they're called differently. So know the range, know the branches. Navies or sailors, right? National Guard or the Guard. So you don't just assume, oh, you're a pilot because you're in the military, right? Or you're a soldier. Uh, no, it's very different. Know what kind of job they're doing or what they did in the military. What did they do prior to being in the civilian? So that you kind of know what experiences they have. An open-ended question, that's nursing 101 for us, right? When you assess a patient, you ask, okay, what is going on? Let them lead the way, because at first they may not trust that and may not be open for what experiences that they may have. Um, don't touch the patient because they may have PTSD. They may have a history of military sexual trauma, right?
Mhm.
So that is different as well. I mean, these things are kind of in the civilian world, but very different experiences when it comes to our veterans and service members. So I just want to highlight that.
It's important that you do that because one of the cool thing about being a practitioner, nurse practitioner, is that we're taught about delivering holistic care. That
Yes.
patient care is individualized, and it is not good practice to make an assumption that just because someone say they serve, that we assume that it was army and so forth. And one of the things that I wanted to piggyback on is when you said to always inquire about exactly what they did or what they do, because it's actually connected to so many of the health concerns that we have today. I
Yeah.
remember when I was doing clinicals in NP school, there was, I don't know the name of the actual agent or chemical, but many of the patients that I was caring for, they were exposed to that. And there were some issues that they end up having later on in, late adulthood. So I didn't make the connection until my preceptor says, this is why you should always ask, where did they work? How long were they exposed to it and what they were exposed to? So Anna, I thank you for highlighting that so people who are watching us, they understand that when it comes to patient care, it's really about taking the time to hear them out so you could better meet their needs.
Yes,
Now,
exactly right, Dr. Patrice. Because when you're talking to a veteran, you need to know which era they served in. Vietnam veterans are very different from post-Vietnam, right? What did they experience culturally coming back? A lot of these veterans do not talk about their past. They are embarrassed because of that culture time that they were not accepted. Very different from the Operation Enduring Freedom or Operation Iraqi Freedom veterans that are able to talk about these things. Know about Agent Orange. I don't know what it was that that your patient was exposed to. How about the burn pits, right? The smoke inhalation. What
yes.
were they exposed in? And there's a lot of studies that the VA is doing that are saying why is it that this patient population during this era are having these symptoms? So a lot is to be understood. Yeah. So it's important.
Wow. It is important. It is important to make that correlation between their exposure and where they served and how long they served to what is manifesting today. Now, when it comes to mental health services, because I really want to highlight this before we go, would you say that the need is greater while they're serving or after they serve?
I think it goes both ways. In the military, there is a ranking system, right? There's a stigma in mental health. Same with the civilian population. Military, you're strong, you're vigorous, you're go-getter, you're gonna do this, you're gung-ho. You cannot be perceived as weak because I'm gonna go to mental health. So there's that fear. There's also a fear of not being promoted if they go to mental health. So it is a taboo at times. Now it's kind of changing, but we still have a lot to go through. Break the barriers, break that stigma, because that patient may be having a lot of things that have gone on when they were little, escaped that environment, went to the military, now they're in combat zone. Now they have military sexual trauma. Now they are transitioning to the civilian life. They were a tanker, they drove tanks. How are they gonna do that, right? How is that gonna equate to the civilian population? So you gotta know these things, the ranking structure, all of these things that are very hard on them as they transition. Right now, 17 to 22 per day suicide. So yes, 17 to 22 a day veteran suicide completed.
That's alarming.
That is alarming. That is alarming. So you as the provider, even though you don't work in psychiatry and you meet this veteran, assess. Do they have firearm access? Do they have passive thoughts of suicide? Do they have active suicide, right? Active suicidal thoughts. Do they have an intent? Do they have a plan? Call their family. What's going on in the family? Collaborate. Very important to get that collateral information and make sure they're talking. Substance use. A lot of our patient population in the veterans are using substances to kind of curtail and self-medicate, and because I don't want to deal with the past. I don't want to deal with a combat that I saw and now their friend have committed suicide, their military family, right? So you as the provider have to be open, not just because, oh no, I'm in primary care, I don't do that psych thing, but you treat holistically, like what you said, Dr. Patrice, important.
And it's interesting that you mentioned that, because usually at this point, we always ask, what should every NP know? And you've already answered it.
Oh.
For them to understand that there should never be any type of silos when it comes to the treatment of veterans, not just veterans, all patients. It should always be, okay, even though I'm in primary care, let me connect you to the next resources, and to be aware of the resources that are out there. So you can make a referral and let the patients know that you care about them, their whole being, not just the physical aspect, but what's going on with them mentally. Now, how can students and our viewers get in touch with you if they want to know more about Hope Center for Veterans, as well as just, I believe you also provide mental health services too, via telehealth. So how can they get in touch with you?
Yes, to increase the access of, to mental health, I started this telepsychiatry now. But for Hope Center, it's www.hopecenterforveterans.com. Veteran Crisis Hotline, 1-800-273-8255. Press 1 for assistance or text 838-255. Very important. Or go to my website, email me, contact me. I'm here to support all our veterans. I'm here to support nurses, nurse practitioner students, and other nurse practitioners, my colleagues. If you have any questions about veteran care, I'm here.
Well, Anna, I am so delighted to have you here. Students, viewers, I hope that you were able to get some takeaways, because I have. And I hope that you stay tuned to join us next week for another episode of Let's Talk here at NP Student, the definitive voice of nurse practitioner students. You have a great day.
Thank you. Appreciate it.
Thanks for tuning in. Don't forget to subscribe, like, and share.